So I've seen that there's been quite a lot of debate, and I think particularly in the UK and America around healthcare systems. So what I wanted to do here is have a bit of a deep dive into the UK health system from a holistic, almost economic perspective, but then also looking at the social factors around why it's so heavily politicized and whether this is actually warranted, granted that you'll have inescapable political motives around discussing health systems which are core parts of government policy, at the same time having it just as this institutional function which runs day to day almost no matter who is in charge of the health ministry in general. I think first of all I want to start by saying that we have to think about healthcare as a very alienable right? Well, it's not an inalienable right. We've developed a healthcare system because of our prosperity, and that's this sort of privilege that we've now owned. There's no guarantee or right to healthcare in any country. It's just if a country is wealthy enough, it tends to have a healthcare system, and that healthcare system can either be private or it can be public and be the burden of the taxpayer or the individual resident or person. So just to get that out of the way, I think there's a general idea that healthcare is in itself a panacea against the public ailments, but this idealization of it being this sucker for all of the weak and sick and ill is just not necessarily true. I think we have to also think about public health as a responsibility split between what the government can provide you for redress and for helping you when you are sick versus preventative healthcare solutions like you being healthy yourself, exercising, eating well, sleeping well, treating yourself nicely, in general, stress, smoking, drinking, that sort of stuff, right? So we can start here, I guess, with the principles of a healthcare system, public especially, and if there's any moral hazard to that. So in general, moral hazards are basically when you have the system structured in such a way that you're not incentivizing people to not use it. So there's this almost, they call it a moral hazard in economics, but there's this instinctual ability to say, I'm going to smoke because at least I know I'll have my healthcare when I get emphysema or lung cancer taken care of for free anyway, so what's the downside? Obviously, it's very loose reasoning around that, but in general, that's what we can think about as a moral hazard. Now, I don't necessarily think there is an especially conscious moral hazard here, but I think there definitely is an unconscious assumption around what is going to happen if you get sick in the UK, especially with the NHS being this grandfatherly, all-curing figure standing above you. So, which is to say, I think when we talk about healthcare, it is very, very important to understand that there's a real and localized responsibility for you as an individual to be healthy, and that it's potentially can be seen as society's benefit to get you healthy again, so when you are sick, because we're all better off if everyone's performing at 100%. But in general, I think that's a great way to look at it. Whether we take liability for our own health can be seen through private health insurance and other subscriptions, vis-a-vis gym subscriptions, anything dietary that you might do, sleep, if you're a drug abuser, things like that. So you have to be very mindful, I think, of these things. Now, getting into the crux of the NHS here is to say that there is good news and bad news. I think politically, it's almost worthless to listen to politicians debate any of this stuff. You have to understand politicians, particularly in the UK, are not educated in anything, statistics, economics, other than PPE degrees, which is very loose. Most of them are either legal backgrounds and or have only worked as party advisors or internal think tanks or in governmental civil service, which is all very I don't want to be mean here, but it's all very nugatory work a lot of the time, where you're just running reports with no factual reality in terms of informing on truth, rather than like with a business, you can't operate in a fantasy world because you won't have customers. If you work for the government or for a party, you work in this alternate reality almost of party ideology comes first, and doctrinaire thoughts and things like this. So to understand how politicians think is to understand how someone fresh out of uni who's never been exposed to real life thinks, more or less, and that as they get older, it just gets worse. So the bias and the jaded political critical thinking disappears even gradually from a very low start point. So when we look at healthcare, it is important to understand that politicians almost never know what they're talking about. Even the ones that are, I used to be a doctor, whatever. You have to understand a doctor is very skilled at what maybe they do, but they're not legislators around how the function of a healthcare system works. So there's a lot of money spent on the NHS. We can see here at the top, see here at the top here that there's been a steady increase. This is to be expected, I think, in general. As the economies get bigger, the population increases, there's an expectation around just spending more. There's also been a marked and stark increase in the I'd say usefulness, but also quality of healthcare over the last 50 years, 60 years. So I don't think this is an unfair basically chart here to be looking at. As a percentage of GDP, I think the UK is fairly in line with OECD averages. Japan, America obviously being highest, it's like 16% or something, but in general between 8 and 12% is a fairly actually average. So I don't think it's to be a shocking number here for the UK. What is interesting, I found, is that the UK spends not that much on admin, so which is quite a good positive sign. I would say administrators add very little value to a lot of healthcare systems. You can have obviously very critical and key personnel in the administrative system, but in general, a lot of the solutions should be solved by technology rather than more people. America is a really good example of why administrative spending is a worse deal. You have really bloated healthcare systems, particularly in hospitals, around administrative staff and almost CEOs of hospitals because of the way you commercialize healthcare, which has no improvement in, say, health outcomes. It's just a way of constructing a system to benefit and enriching people. But in general, I think the UK's issues are not, say, philosophical around how the NHS is set up. You can see here I took one of their 7 missions they have, but they're committed to providing the best value for taxpayer money. And you could probably consider this to be true and reflective maybe of the operational status at this point. But what it does have not going for it is the population itself. So the UK, being a first world country, as with all first world countries, has a declining birth rate, which means you have an aging populace. And you can see the structure here, but there is basically a huge expectation around 2030 to have a majority of the population, albeit the median above 40, and then a good 1/3 on the other side of 40, but much more closer to 60 in death. You have way higher requirements around healthcare spending for this age range because of the sensitivities of old people to health complications, so whether it's illness or sickness or injuries, extra care, nurses, hospital visitations, things like that. They're just much higher. Compounding this, and you can see this over here, is this adult obesity. So the UK is one of the fattest countries in the world, and I've even got it broken down, as you can see over here, by race and age for youth, because youth is a good indicator. Most fat people and portly, rotund individuals almost never lose weight. So something like 90% will be, if they're fat when they're 18, they'll be fat forever. So it's quite an alarming statistic, and it's for me it's considered child abuse at least to have an obese child. But in general here you can see that the percentages of children in reception in the year 6 identifying as obese. Obese is not even overweight, so obese is actually clinically 2 or 3 standard deviations over what the mean average weight should be, and then overweight you can obviously say it was 1 or 2 BMI higher, and then obese being much higher. So here it's very alarming because obviously in reception and year 6 you have figures that should be 0, with the white population being almost 10% in reception and then 20% in year 6, which is obviously very shocking and alarming, with the rest of the population doing worse, more or less, except for the Chinese, and even then by the time they're year 6 they're actually still quite fat. I think it's a huge, and this is probably should be what the political debate centered around, is improving health outcomes prior to hospitals, prior to the usage of the NHS. There is no way that the dietary and physical activity levels of the youth in the UK should be as dire as this. It is very alarming, and I think there needs to be a lot more discussion around that. We can talk political about it, but I think in general, if you're a parent, this is inexcusable. And it relates up here. So this is the admissions to the NHS or for obesity related, and you can just see it's a steady incline. This is not scheduled to dip either. So every year people get older and fatter. You're having what is a tsunami of poor health outcomes in that sense. So we can see why the NHS is actually doing quite a good job, because it's still having a fairly improving effect on cancer mortality, cardiovascular and respiratory mortalities, just indicating that the quality of care is actually improving despite us being unhealthier as a populace in general. And the UK having at least as fewer CT and MRI scanners, meaning that the infrastructure spending is probably also lower. You can give a lot of credit, I think, to the management of a system where we find ourselves inundated with probably unforeseen levels of certain, you might call them illnesses, but complicating factors around, say, diabetes, blood pressure, cancer, respiratory system mismanagement. And when we're thinking about this, you also should be aware that a hospital and the healthcare system is not in general treating every disease in one go equally. It's to say, if everyone goes in for one certain type of cancer, that doesn't mean all the doctors who treat cancer can now treat just 90% and stop doing the kind of cancers, it's colon cancer, it's lung cancer. These are vastly different and vary in their treatments. So you have to have specialists for this stuff. But if you have a lot of obesity related illnesses, then they tend to converge around the same sort of things, which means your healthcare gets strained in spikes. So having a really fat populace, or having a lot of smokers, in the UK there's a lot of also heavy drinking, which correlate with, say, kidney and liver diseases. So when you start to snowball a lot of these poor health factors, you actually strain healthcare systems in ways that's spiky or not necessarily homogeneous around a balanced system, where you can maybe project health outcomes or the needs for certain treatments and drugs in a way that makes sense. So hopefully that's a bit clear as to actually the good performance of the NHS versus how we're treating it by treating ourselves. Then the last one I think is, well, the last maybe 2 points to say around this is how I did go over spending. Obviously, proportionally spending is for much older people and poor in general, but there's a lot of debate around this, and I've seen this online to say, like, we need immigrants to fill in jobs. I think it was basically the credo here is to say that immigrants are the ones treating us or something like that, which is patently false. And I think for me it's very interesting to have a look at this data, because you see how heavily reliant you are on actually native born British people and white Britons basically, which is to say that most of the other ethnicities are more or less serving proportionally to their own communities. So having immigrants is actually not making a British healthcare system better or having more skills, or there's not more specialists. What you're really doing is just diluting what you would just call the native or the UK healthcare system serving UK people into just having a international healthcare system serving each other proportionally. And this makes sense when you look at where they're serving, because obviously there's higher concentrations of immigrants in these communities versus, say, the Midlands and the Northwest and Southwest. Which is to say, I think there's a massive overemphasis here that for some reason foreigners are super useful in a healthcare system, rather than there's just the equivalent healthcare system requirements for the foreigners and their relatives. So if you're bringing over 100 people who are from Iran, then yeah, maybe one of them is a doctor who's really good, but then 99 still have to go into the system. So then you have to look at the healthcare as a tax-paying base. And if these immigrants are contributing positively or negatively, is going to inform you whether there's a sustainability element to their representation in a healthcare system. So if you're importing, and it looks like here there's a lot of 52 from the EU, so 5% are from the EU. If the 5% of EU immigrants are contributing more tax base than they're taking out of a healthcare system, then it's kind of this at least positive, or like a net positive in terms of budgetary and fiscal requirements around the healthcare funding. Whereas if it's obviously negative, then you're just taking more out, even if they're providing a doctor here and a doctor there who was able to put a plaster on your hand. In any case, I think it's very interesting that the debate should probably be centered around health rather than the NHS, and the NHS is just actually quite a fairly okay functioning public health system, and that there's not that much necessary public debate around it, and that funding requirements don't need to necessarily go up, and that if you had people just eat healthier and exercise, you would find that there'd be less strain on the healthcare system, particularly if you also introduced what would be policies around higher birth rates, because then obviously you have less strain on a taxpayer base which is aging, because you'll have at least a new generation of taxpayers, and some of them will be doctors and nurses. But anyway, that's my quick, hopefully insightful overview for you on the NHS and why it's actually quite a good system, but the UK health scores are declining and very poor. So please don't overfeed kids and make them run around a bit more.